In Atule Joka, live for us in the Eastern Cape. The very latest numbers we have with regards to the Eastern Cape is that in terms of the 17th of August, total cases is 84,092. This is a percentage of about 14.3%. And in terms of the fatalities, 2,567. Recoveries, 79,947. That's the numbers that we have as of yesterday. Atule Joka is live for us now. Atule, just give us the latest. Has those numbers changed in any way?
Well, thank you so much, Blaine. Well, indeed, this was what the Premier was touching on, saying the Eastern Cape is now at 95% of recovery rate. So he has commended healthcare workers, he has commended all the people who have been on the frontline service, saying, of course, that this was all attributed to their hard work. As you would know, earlier this month, we were here with the Deputy Public Protector. She did point out some of the issues that were facing the Eastern Cape, saying there were systemic, structural, and infrastructural issues that are facing the Eastern Cape, saying, of course, some of those issues with the resources, they were not using proper resources, and that there were a high vacancy rate in the Eastern Cape, and also there was a management instability in that 4 of the hospital that she visited, 3 of those, they were acting CEOs, so that was not providing a coherent leadership to the people, and also saying, of course, that this is affecting how healthcare workers are able to provide efficient and effective services to the people of the Eastern Cape. So those were some of the issues that he was touching on. The Premier saying they are trying to address the high vacancy rate. They are recruiting some people. They have advertised some posts, and also they will be training some of those managerial positions, saying some of those people who are acting must manage these facilities, and that they will provide a training for them. And also the infrastructural issues, they're saying, of course, the 251 million that has been allocated and put aside to address some of the infrastructure backlog in the Eastern Cape. He was here today. They were also addressing some of those problems, and that this facility that we are in is one of those old buildings. It has been refurbished. It is now looking to admit some of the patients. So they do have now more efficient beds and more efficient facilities to cater for the people. So that's what where we are standing today now, Blaine.
All right, so the number I have in front of me in terms of infrastructure is that 68 health facilities are being refurbished in the province at a cost of 657 million rand. Is that correct?
Well, Blaine, what we have heard at the moment, those were not the figures that we got here, because he did give us a breakdown of those facilities and also the municipalities that were allocated some of those funds, saying, of course, Buffalo City, there was 60 million that was allocated, or Tambo, there was 60 million that was allocated, and also Nelson Mandela Bay, there was, so it did not get to that 600 and to that over 600 million that you've mentioned. And also earlier on, we were speaking to the MEC for Public Works and Infrastructure. Earlier on, she did mention that the Eastern Cape was facing a serious and a dire shortfall at the backlog of infrastructure in the Eastern Cape, in that there were over 800 million backlog they were currently facing, and that they had 251 million to address some of those problems. So there is still a long way to go, Blaine. It is a step-by-step process, if I may put it that way.
Long way indeed. Something that we've been warned about. The caveat is, although we're down to level 2, the need for not to be complacent is very, very important, all the more important at this stage, because the economy is opening up as we speak. Eastern Cape very much in sharp focus in the build-up to moving down to level 2. No doubt, Atule, you're testing the temperature of views on the ground. What sort of sense are you getting with regards to this move down to level 2?
Well, as you would know, the Premier of the Eastern Cape, Mr. Oscar Mabuyane, was quoted as saying he does not support the unbanning, the lifting on the ban on alcohol and tobacco not so long ago, because some of those casualty wards were overwhelmed with people being involved in accidents and also being involved in some of the dangerous activities. So today he was here to say we do support the unbanning of tobacco and alcohol. This will support in the economy in the Eastern Cape. So the people on the ground in the Eastern Cape do welcome the moving to alert level 2, but the Premier did say they will go out to people to try and make an awareness to make sure that people do not drink irresponsibly, and that the casualty wards are not overwhelmed, and that they are able to mitigate the spread of the COVID-19. He's also emphasized that people must still live within the confines and making sure that they do mitigate the spread of the coronavirus, and that they do not spread COVID-19. So now the challenge in the Eastern Cape is that the unbanning of alcohol, as we know what happened the last time this had happened. Blaine.
Atule Joka, live for us in the East Cape. Thank you.